Hi, I'm Mary Chris Ramos from Group 10, and this is my anecdotal in our duty in DDOPH Pantukan OR rotation. So this is my anecdotal video from day 1 to day 6. So basically this video contains total of 6 days of duty in OR sa Pantukan. And I'll show some of the clips, but mostly I'll do the talking because during our first day we were oriented that we're not really allowed to bring phones, to use phones, but RCI, Sir Lex Morata allowed us to do so, but with limitation of course, and we respected that, so there's not much clips. And yeah, so during our first day there at OR in Pantukan, of course we had our little tour, just a small or mini orientation of the place, introduction of the staffs, the nurses, the nursing attendants, and the doctors. And this picture shows the insides of the OR. I only show this picture because I don't have any more pictures of the OR, but just the group pictures. And then we had a reinforcement of knowledge, basically reviewing the instruments in OR. So there was this area where they dry the previous instruments that was used, and me and my group mates just hangs out there and try to review the available instruments there, because of course we had to reinforce some knowledge, because the last time that we had our OR rotation was months ago, and by the help and the guidance of RCI, we were able to had a review of the instruments and its uses. So this picture shows the area where we do our review. So since our first day up to our last, there are a lot of surgeries, and we are there to observe, and it's really fascinating and amazing to watch all kinds of surgeries. But mostly from day 1 up to our last duty, mostly it was more of a DR case, which is CS section, but there are a lot more cases, minor surgeries, and it was really fun to watch, and we also learned a lot. So we also stayed at the PACU, where we're in charge of monitoring the post-op patients. So in this picture shown, the nurse on duty allowed us not only to monitor but to also try IM injection on our post-op patient with his guidance. And after that, we had a little health teaching and reinforced some of the knowledge to us. So again, I'd like to apologize if I don't have a lot of pictures or video taken to be shown in this video, because during our first day we didn't know actually that we're gonna do video anecdotal or telling about our journey. So I had to talk my experience, not more of a vlog type. So yeah. So all throughout our duty, these are the things that we learned from Sir Lex. So during our first day up to last day, these are the things that we did with and we learned with Sir Lex. Number 1 is reinforcement of, or more on a review of OR instruments and its uses, and how they work, or the system of the hospital there. And next is we had a discussion or a very good talk with Sir Lex about career options. And for me, it is very helpful and great to have a talk with that with RCI, because it felt like RCI not only guided us just in clinical rotations or in clinical areas, but also paved his way into our emotions and talk into our life that really served as our guide. So he talked about his experience and gives us some insights on what career path should we choose. It's just really nice to have someone to talk to like Sir Rex, who has a lot of experience in this career, in his field. This is his field, and with his and basically with his expertise, he helped us have some knowledge, background knowledge about some certain areas in nursing field. We basically had just an open conversation, just like a question and answer, and that is really helpful and thoughtful of Sir Lex. This is a day where we know
Welcome to our friend. This is the first day of duty. Nasa second week sa,
it is basically just trying. So from the last clip, that showed my group mates trying to review gowning and closed gloving technique. We had an RD, a graded RD, and another one is the inserting knife and removing it. So we had an RD for that. It was graded, and then it was really nice because we had it was really nice and helpful for everyone who kind of forgot and basically just reinforced some knowledge. And it's nice because we learned a lot from one-to-one experience. So after our RD and after our quizzes, it served us our a graded quiz also, the RD. And the next is more surgeries to observe. And this is one of the minor surgeries that we assisted, and just more surgeries after more observe. So again, what we learned from Sir Lex, it was really a lot, and it was nice for us to have someone as experienced as him, for us to have this comfortable environment to ask and learn from him. So again, what we learned is number one, reinforcement of knowledge sa OR instruments and its uses, career path options, RD of gowning and close gloving technique, and then next is the removing and inserting of knife. And then another one is just a really bonus. We mentioned to Sir Lex that we were curious of inserting IV, and we had a talk where we shared our experience that we really didn't have any background knowledge on it, although it was mentioned in some lectures, but hand-to-hand experience, no. RD, no. We had just basically small knowledge about it, and we were curious about it, so he offered to teach us on IV insertion. So this was truly an experience for us that we will remember, that once in our life when we were students, we learned how to do IV insertion with Sir Lex. And someday when we were gonna be nurse, we will remember that as students, we learned how to do this because so that's basically the sum of our duty and pantukan. Not only we gained a lot of knowledge, but we handled a lot of case. I just didn't have much pictures and videos because I respected the rules that we're actually not allowed to have our cell phones. But thankfully, our CI is very understanding and kind. He let us have our freedom with it, but of course with limitations. With the knowledge and the guidance of our CI, his expertise helped us a lot, especially in this case where we were just students trying to learn. Our CI is also very hands-on. We had a lot of fun and basically just hangs out and learns at the same time. From knowledge to skills and talks in life, we're grateful to Sir Lex. So that's the sum of our duty and OR on Tupan.